Today on Dueling Doctors, myth-busting is on the menu. We're tackling medical misconceptions and misperceptions, from head to toe when it comes to things that may or may not be good for us. On deck, do detox cleanses really work? What's the deal with dairy? And can deodorant really be harmful? Doctors from the world of holistic, natural, and conventional Western medicine face off to help shed some light and demystify these issues once and for all. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional Western and natural holistic medicine join us to debate and discuss the best ways to treat what ails us. Let's get started by introducing our guests. On the holistic side is board-certified acupuncturist and herbalist Mary Sabo. And here with a more Western approach with a specialization in rheumatology is internist Dr. Natalie Azar. Welcome, both of you.
Thanks for having us.
Okay, our first topic to myth bust is detoxes and cleanses. Now, people love the idea of cleanses. Purifying the body and detoxifying the body appeals to us on a physical, spiritual, and psychological level. But are they really healthy or just a bunch of hoopla? Detox diets, or cleanses, are touted as a way to remove toxins from the body, but some even promise weight loss. Although they vary from one to the next, they usually involve a period of fasting accompanied by a strict diet or a pre-formulated drink. Foods that are often off limits include dairy, gluten-containing foods, sugar, fried foods, and processed foods. In addition, some cleanses incorporate colonics or enemas to draw out harmful toxins and residual waste that's trapped in our colon. Each of our experts has up to 1 minute to give their opinion, and then the other will have the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Azar, you went first. So before we even get into it,
Yes.
It's a big fad right now to do cleanses, detoxes. You hear about them all the time. I remember reading about Beyonce and her cayenne pepper, maple, and I don't know, green tea. But doesn't the body naturally detox using the colon, the kidney, and the liver?
The liver, yeah, it's supposed to. And you know, unless you have renal insufficiency or liver disease.
Like kidney problems or liver problems that might impede your detoxification.
Right, they could impede it. I mean, I personally, I'm not a huge fan of the idea of them. They seem to go against what I feel naturally is happening with your body. I'm not aware of a huge body of evidence, scientific evidence, that suggests that they are medically beneficial for people. I think one of the main benefits might be psychological, meaning that you sort of have, in your head, you've given your body a chance to start fresh again, and that may give you some sort of peacefulness. And I don't think that should be discounted. Even if that's a placebo effect or, like I said, in a psychological benefit, I think that's great. But I think that people need to, first of all, clear it with their doctors.
Absolutely.
Make sure they don't have any underlying medical conditions where, you know, taking water for 4 days could lead to a low sodium level and be dangerous for somebody. You know, I think that people need to be really smart about doing it.
Well, I think we could all agree that if you're going to do a detox, especially, I mean, I've heard of like 3-day detoxes, 5-day detox. I've heard of like 30-day detoxes.
40 days.
I mean, really, you should talk to your doctor first, especially if you have liver, kidney, heart disease, diabetes. I mean, I don't even know if these people should even be on a fast, but I do agree with you at one point. It goes against everything we learn.
It does.
And you're telling somebody, we want you to fast, which we don't really tell people to do. We tell people to eat properly.
Correct.
So I don't know where it comes into play that you're actually doing something, and then what happens to you afterwards?
Well,
Are you going back to bad behavior?
And that's where, you know, one of the biggest, I think, things to discount it might be that a lot of the weight that you may lose initially is what we call water weight and muscle mass. And so when you start to eat regularly again, you're going to put that weight on, and because you've decreased your caloric intake for a period of time, your metabolism slows down. You may actually gain more weight. If your purpose was to lose weight in the beginning, remember. You may actually end up gaining more weight afterwards and just sort of really starting at a different
baseline. And what is your take on the whole colonic?
Not in favor. Oh my God, the vagina and the colon have naturally occurring bacteria that protect the environment. And so douching and colonics and things like that wash away the healthy bacteria, just set you up for super infections with perhaps more, harmful bacteria. The tubes that they use for the colonics, who knows how clean they are? They can cause perforation.
That's a horrible thought.
It's not in a controlled
and perforation
setting.
meaning like
A
adding too much air,
perforation
they could
of the
tear
colon.
the colon.
It happens during a colonoscopy. This could happen in your home. You could really succumb to that.
All right, very good points. All right, Mary.
Okay,
I'm leaning over here today.
I'm actually a fan of cleanses, but I think we should differentiate between cleansing and fasting. So
Okay.
fasting would be more of like a water fast or even juice fast.
So fasting, not eating
So fasting
food.
is not eating, yeah.
Okay.
But I think cleansing, which can be more for the mind, but it's also kind of rebooting habits. So oftentimes we get really stressed out, we're eating more processed foods, we're eating more foods that maybe aren't the healthiest options, they're just quicker, we're eating more, we're drinking more caffeine, and then we're drinking some alcohol to calm down at night. We're maybe taking prescription meds. All these things kind of
I get it.
overwhelm
So you're
our
trying
livers.
You're trying to put a pause on
Right,
people's lives,
right.
help them reboot.
Right.
And so what do you recommend during the cleanse?
Yeah, so you can cleanse simply by cleaning up the diet, and that would be kind of cutting back on animal products, especially dairy, and lots of water. That could be a
But
cleanse.
aren't really these fad detoxes
Yeah.
and cleanses, aren't they a form of fasting? You're not eating enough. I'm afraid that you're not getting enough calories.
You
And
can
then
eat
when you
enough,
start,
though. I mean,
but
you
aren't
can-
you starting to break down muscle, as Dr. Azar
Not if
just
you're
said?
getting adequate protein. I mean, when I cleanse, I still have some clean animal protein.
So you're not
some
in favor of
grass-fed.
this cayenne pepper, maple
No,
syrup?
actually, Chinese medicine does not like water fasts. It's too depleting.
Yeah.
It's too
Yeah,
depleting.
so you can do a cleanse just by cleaning up the diet, like I said, maybe adding some gentle herbs like milk thistle, which is good for the liver.
What about just taking a
dandelion,
probiotic, milk thistle,
yeah.
and maybe some green tea in addition
Yeah.
to eating better?
Right, and eliminating the load on the liver.
Because I think really you touched on it with the psychological thing. I think when you don't eat for a couple of days,
Yeah.
and I did a fast for 5 days,
Yeah.
and believe me, I thought I was seeing God by
Yeah.
the end of the 5 days because you're like that. I'm
Yeah, yeah.
starving.
The Buddhists
Yeah,
do
for
it,
spiritual
for Yom
reasons.
Kippur.
Yeah.
I mean, it's
Yeah.
like, historically,
Right.
there's definitely, a precedent there.
Right.
But, again, what are these people really, are they getting a health benefit from it? I'm not sure.
And I don't recommend it for weight loss.
Right.
I recommend rebooting the diet like that for weight loss and then continuing. But you need to get proper caloric intake,
Right.
or
I
your
really
metabolism
like
is
your
going to slow down.
distinction. I
Yeah,
like your distinction
thank you.
about a
Yeah.
fast versus a cleanse. A cleanse sounds
Yeah.
like, you're changing your lifestyle
Right,
versus
right.
this
Yeah,
quick
and I
fix.
think really what you're doing is what you said. You're not eating processed foods,
Right.
which is great. But then the real key is when you go back on real food, you have to avoid those foods again.
Right.
Because if you're
Yes.
drinking a ton of coffee, a ton
Yeah.
of soda,
Yeah.
a ton of packaged preserved
Right.
food, and then you go back and eating it again, it's like, well, what was the point
Right.
of the fast or the
Right.
cleanse
Well,
or the detox in the first place?
The cool thing that I find with my patients is that when they do the cleanse for about 10 days to 2 weeks, they start to notice a difference in how they feel, and that's the benefit. So they don't want to add those foods again because they start
They
to
positively
feel
reinforce
that, yeah.
themselves.
So symptoms like PMS in women, headaches, migraines, insomnia where you're waking up a lot at night, those things can all be helped by a detox.
So let's just say, let's go through this again. So if you were going to not even do a cleanse, but maybe wanted to add something to your diet that was more cleansing
Yes.
or detoxifying, how could you do that with real food? What would you recommend?
Yeah,
Green
just
leafy
cleaning-
vegetables?
Green leafy vegetables. You could actually do a green juice every day. That would be great.
So what would you
Where
recommend? Spinach?
Kale, dark
Kale,
leafy
kale,
greens
kale.
like Swiss chard. Taking a fiber supplement too sometimes if you're
Fiber.
not getting adequate fiber in your diet, especially if you're doing any sort of cleansing, you want to make sure that you're having at least 1 bowel movement a day, if not 2, because the colon is the primary way to eliminate those toxins.
And how do you feel about the colonics?
Chinese medicine isn't a fan of those either. The
Really?
chi flow of the colon is one direction, and making it go in a different direction can mess up that flow. And like I said, there's risk of perforation. I have heard awesome stories about people having really great benefits from
Like
colonics,
what?
but
I really think it's psychological.
Yeah,
I think if you give a colonic and you
Yeah.
see all this stuff come out, you
Right.
go, oh my God,
I
that's great,
know.
because that was giving me cancer.
Yeah.
But there's really no
I don't
proof
know.
that it
I'm
does.
not going to discount people's stories that I've heard, but I haven't had one myself. I don't promote it to my patients.
Okay, well, good to know. Well, we have to take a break. Up next, is dairy good or bad for us? The jury is out, but our experts are in. Welcome back to Dueling Doctors, the show where health experts come together to debate and discuss the facts and the figures in the worlds of conventional Western and natural holistic medicine. We're myth busting today, and the topic up next is a debate on dairy. We're joined by board-certified acupuncturist and herbalist Mary Sabo from the Unova Center, and from New York City's Lango Medical Center with a specialty in rheumatology, we have Western-trained Dr. Natalie Azar. Welcome, ladies. One question my patients have been asking about lately is whether or not dairy is good or bad for them. The U.S. Department of Agriculture's dietary guidelines recommends 2 to 3 servings of milk a day. Updated guidelines urge Americans to get more fat-free or low-fat milk and related dairy products. However, according to Harvard's food pyramid, milk is not an essential part of a healthy diet and may pose risks. Each of our doctors has 1 minute to present a case, and then we'll debate the pros and cons of each. Dr. Azar, you went first, so we're going to start with you, Mary. What's your take on milk?
Well, I think we can all agree that cheese is yummy. However, dairy is actually the #1 food allergen according to the American Gastroenterological Association. And it can cause food allergies in children, creating asthma, IBS symptoms, which is chronic constipation or diarrhea. It can cause some fatigue. It can cause eczema. So you really have to be careful. I think, we used to think, there's calcium, there's potassium, there's magnesium in dairy, so it must be good. Vitamin D, it must be good for our bones. But studies have shown recently that countries where less dairy or no dairy is consumed, they have better bone health and lower risk of bone fracture. So I think we're starting to kind of tease out that, yes, calcium, all these nutrients are good, but not necessarily from dairy. And you can get all those micronutrients I talked about, all those minerals from things like broccoli, spinach, kale again, the super vegetable.
So is it your belief that as we get older, we don't need dairy because more people are becoming intolerant to it?
Our guts change after infancy.
Sure.
So actually we don't need dairy after we're done being babies. Our guts actually change and they're not able to handle it as well. In Chinese medicine, dairy is very difficult to digest, so you have to have really robust digestion in order to assimilate it. Otherwise it kind of slows things down and it can create mucus in the gut.
Yeah, I do believe that there is some truth in all of that. I do find that what I hear from my friends and patients who don't eat dairy products is that there's also the fear of the abuse to the cows. Does that factor in at all? That how animals are raised and treated and how they affect what we eat?
That's a personal choice, I think. But in terms of health benefits, which I think we're kind of talking about here,
it's true. Cows in this country are given recombinant bovine growth hormone.
Right.
Which
is a health risk, right?
Which is a way of producing increase in meat and milk products.
And that can get transferred into the milk.
And that could get transmitted into the milk. It could also increase insulin-like growth factors.
Yes.
And there's a concern about all of that and how that affects humans, even though we pasteurize milk. And they say, okay, you're not going to get any of that.
I had a friend once who stopped drinking milk after he heard there was pus in it. They allow so much pus particles into their milk. I know, I'm not kidding. Yeah.
It's interesting. Okay, so what's your take? I mean, we all probably grew up on milk. I mean, is it safe to say that?
Yeah.
I did. I know we had a glass of milk for breakfast every morning. At what point is that not good, or is it good?
My take is this is all going to be about bone health. And I think there's 2 extreme populations we're talking about. We're talking about our children and adolescents, and particularly girls reaching their peak bone mass, where dairy, in this case, unless you have a mother or a very progressive family who's going to make sure you're getting your leafy greens when you're 5 years old and your kale when you're 6, you're going to have milk with your cereal, you're going to have cheese, and you're going to have yogurt, little yo babies, etc. I feel really strongly about this. If women don't reach their peak bone mass by the age of 18, 19, 20, they're never going to reach it, and that's the #1 cause of premenopausal osteoporosis in this country. On the other side of the thing are the women who are postmenopausal who have osteoporosis and perhaps vitamin D deficiency. To say to the public that dairy is not good for you is sending the absolute wrong message. The debate in my mind is whether or not calcium and vitamin D supplementation helps to reduce fracture risk, and I think we all feel comfortable. The study that came out in February in the Annals of Internal Medicine from the Women's Health Initiative is that there didn't appear to be a fracture risk reduction in the women who took calcium and the women who didn't. That study was fraught with some design flaws, so I'm not even sure we can say that. But for the healthy 40, 50-year-old woman, probably calcium supplementation of 1,000 milligrams and vitamin D of 400 is not going to make a huge difference.
Do you really need 3 servings of milk? I think there's too much fat in milk and milk products.
Right.
Now, if you got low-fat milk, great. We all know about the DASH study, and it looked at risk factors for hypertension.
Right.
And yeah, 1 or 2 glasses of dairy a day is probably not going to be bad for you.
Fine. Unless you're allergic, and then it can trickle down, and it can be a hidden food
it's a bad
allergy.
thing.
Listen, I have 2 young kids. I'm not sure, allergy in children. If your kid doesn't have an allergy, they're probably not going to get it.
Right.
If they have eczema and asthma, then you can start eliminating.
But I was going to say, I think
Or
the distinction is, I think
constipation
as an
or
adult,
Right.
and I think as an adult to tell adults they need to get dairy, it really is confusing. I don't know if adults need all that dairy as
Yeah,
much.
I
And you
agree.
could get supplementations and
And,
not
well,
have
or
to
just eat
drink
vegetables.
or eat vegetables.
One word about the calcium supplementation and why I would say that for women who are trying to get some calcium, I would still prefer that they do it with a glass of milk than a calcium supplement, because there has been recent data that taking calcium and vitamin D supplementation inundates the body with too much calcium and actually can lead to cardiovascular risk. So, to be continued.
To be continued. There's a lot of information there. We're going to take a break. When we come back, we're going to make a stink. Our conventional and our holistic doctors debate whether deodorant is really your friend. Next. Welcome back to Dueling Doctors. Today, our holistic and conventional experts are myth-busting common medical claims, internet rumors, and just plain bad information. Our final topic for the day is deodorant. And I have to say, I wish the crew wore some. I'm only kidding. I'm only kidding. I like the crew. Deodorants are a substance applied to the body to affect body odor caused by bacterial growth, in addition to the smell associated with bacterial breakdown of perspiration in armpits, feet, and other areas of the body. You know what I'm talking about. A subgroup of deodorants called antiperspirants affect odor as well as prevent sweating by affecting sweat glands. Antiperspirants are typically applied to underarms. As always, our experts have up to 1 minute to present their different opinions. Dr. Zara, I'm going to go with you first, but let's just cut to the chase.
Yeah.
Everybody's worried about deodorants and antiperspirants containing aluminum because it causes cancer and Alzheimer's.
Yes. I think the science suggests that there is no compelling evidence that they do. In fact, the Alzheimer's Society themselves say that the amount of aluminum, which I think is one of the more common elements in our environment, is not linked to a greater risk of dementia and Alzheimer's. For parabens, which can be found in both antiperspirants and deodorants, the FDA has issued a statement that they don't believe there's a strong link and that they're still looking at it.
Just to tell us, is what's contained in the deodorant as well. It's just like an additive.
Correct.
Preservative.
It's a preservative.
Correct. But let's keep in mind, I mean, in this way, I think I fall kind of in the middle on this, that the idea of an antiperspirant is that it's blocking a healthy bodily function, which is sweat. Sweat itself is odorless. It mixes with the bacteria that's, present on the skin, and then, with bacterial breakdown can cause odor.
That's what the smell is from.
So a lot of people who I think are trying to live more organically may think, let's go with a deodorant rather than an antiperspirant for that reason. One thing I'd like to mention, because it's been in the press a lot lately, is this chemical compound triclosan, which is a germ killer that's found in a lot of household products. You'd be surprised if you ran the list. And it recently came under fire because the FDA has never actually shown that, number one, that it does a good job of killing bacteria, and number two, there's been some issue raised that maybe there's a risk for cancer and or abnormal endocrinological function like testosterone levels in early puberty and things like that. So, and for aluminum also containing products, patients with underlying renal disease need to be sort of careful about it.
renal
So, I mean,
failure.
I think the evidence is not, I don't think it's black and white, like, everyone must stop. I think, you just have to be a little bit wise about what you're choosing.
Right. I agree. I mean, I'll be the first to say I use deodorant and antiperspirant because it would not be
Never gave
pretty
it a
right
second
now.
thought.
and I get the whole idea of it's natural to sweat.
Yeah.
Sweat is odorless.
Yeah.
It mixes with your skin and the bacteria, and that's what's giving you the smell. But the link to cancer and Alzheimer's, I'm not so convinced.
I tell my patients to rotate. The overload of cosmetics that we're putting on our body daily, especially as women. We're putting lotion, we're putting makeup, we're shampoo and conditioner and hair gel and whatever else. And all of those products sometimes contain parabens. The EU recently banned parabens, so no products can contain parabens there. So they have a different idea about what's safe and what's
But I
not.
also think you have to take into consideration your daily activity. I mean, you should
Yes,
wash every
right.
day,
Yes,
soak in
Absolutely.
water.
Do a cleanse. Clean up your diet.
Right.
Do
Yeah.
a cleanse maybe. But also, what about using hydrogen peroxide in the armpits
Sure,
to kill any
experiment.
bacteria
Yeah.
on
Yeah,
your skin
absolutely.
so that when you sweat, it doesn't
Yeah.
smell so bad and you
Witch
don't clear the
hazel,
room.
too, is
Witch
a-
hazel is
yeah.
also
Yeah,
very good.
yeah.
So I think, I don't know how about I don't know if I feel the evidence is compelling associated with cancer. I know they looked at breast cancer, leaching into the lymphatics.
Right.
Right. Parabens have been
I mean,
found
it
in breast
sounds
cancer
really
tumors.
compelling.
Yeah.
But I don't
Yeah.
know if the amount.
Well,
is
we
really
don't know
going to
until
get
we
cancer.
know. We don't know until we have a study that says, oops, it does cause
Yeah,
cancer,
but for
or
now,
it does lead to.
I think
yeah.
for now
Right.
we do know.
Yeah.
Well, we need to wrap things up.
Yeah.
That went so fast. You guys were great. I learned a lot. I hope you did too. We'll be right back. Welcome back. We're living in a world where there's more information at our fingertips than we know what to do with. And that's where many medical myths come from. Whether you watch TV, read the paper, or get your news online, here are some suggestions for making sure the information you're getting is vetted. Detox diets and cleanses are very popular. It seems everyone is willing to fast in order to remove toxins from their body and lose weight in the process. However, there is little scientific evidence that detox diets actually remove toxins from the body. The benefit from a detox diet may actually come from avoiding highly processed foods. If you're considering a detox diet, get the okay from your doctor first. And to my patient and friend Eric, who's watching, the answer is already no. As far as dairy, I don't feel adults need to consume 3 glasses of milk a day to stay healthy. In fact, the fat content alone in a glass of milk isn't worth the calcium and vitamin D. I recommend switching to soy or almond milk. And even though I'm Italian and I love cheese, I reserve my cheese eating days for those Sundays when I visit my mom. Otherwise, I eat soy-based cheese. And finally, I wear deodorant. There, I said it. If you're opposed to blocking your sweat glands, I get it. That's your choice, but do so knowing that there has been no link with deodorants and cancer or Alzheimer's. I'm Dr. Frank Spinelli. Hope to see you again soon for more healthy discussion as you discover the path to your own personal prescription on Dueling Doctors. And as always, be sure to talk to your healthcare provider first before making any medical decisions. We'll see you next time.